You need to diagnose early to prevent it not to die, right? So that's kind of the layer of common sense and kind of data driven, and this is true for a lot of cancers, and I think we're pretty equipped with data now to see that, if you screen for colorectal, if you early screen for lung, if you early screen for breast cancer, then your chances of survival are magnitudes higher, right? And then there is this higher order question that Artem touched upon, and that is kind of healthcare versus sick care. So what you need to understand is that the healthcare systems around the globe, it's not only US really, it's also in Europe, are sick care systems. And the reason why is that because they're protocol based, the way they think is that they basically get the patient who is already sick with something, and then there is a protocol to tackle this and kind of a decision tree of you're a doctor. I mean, you know this stuff, right? Like you have something and then you do A and you do B, and if it's A, then you kind of progress along the protocol. And for real healthcare, which is preventative, which is personalized, which is kind of thinking ahead by a mile what will happen to the patient, which hasn't happened yet. This kind of requires the whole overhaul of the logic of how healthcare system thinks in general. So again, we're kind of getting into a bit of a philosophic discussion of whether this is possible at all. So I'd stick to data-driven population screening and prevention campaigns, which we kind of know how to execute already, and we try. And maybe not try to change the whole healthcare system from the get-go. It's not possible.